spend more than 5 hours a day looking down at your smartphone, and with the average person's head weighing 11 pounds, tipping at a 45-degree angle, that's 50 pounds of force that you're putting on your neck.
And with this noggin, it's way more than 50 pounds. The strain is called tech neck, and it's the new carpal tunnel syndrome. Top Manhattan plastic surgeon Dr. Richard Westreich joins us now with some solutions. Thanks for being here, doctor. We appreciate it. Let's start with the physical drawbacks of tech neck. How serious can it become?
It can become quite serious. You can actually get significant headaches, shoulder problems, and even numbness or weakness of the hands.
Oh my goodness. You know, when they first told us tech neck, I was like, ooh, I feel like a lot of us are susceptible to this. This is kind of scary. So tech neck also causes cosmetic issues like lines on your neck and double chins. Is there any type of cosmetic solution for that?
Well, fortunately, there is. I mean, we started seeing this a couple of years ago, so I'm well versed in it. But basically, it can cause deep horizontal lines in the neck, as well as some laxity and looseness around the jawline. So there are non-invasive tightening procedures that can be done to recreate the jawline. And for the necklines, you can use filler, skin tightening, and some mild resurfacing treatments, and that usually takes care of it.
Are there any solutions for cosmetic effects of tech neck that don't require surgery?
Well, none of these are surgical. These are all non-surgical, which is great because obviously having to have surgery would be a kind of a bummer just from looking at your phone. But you don't need surgery. They're all non-surgical.
See, all that time, all those times when we didn't want to text people back, doctor, maybe this is the reason why we don't need to be looking down at our phones. Absolutely. You know, as a plastic surgeon, you recommend that people who plan to get a neck lift to also get a facelift at the same time. Please make me understand this because, you know, we're trying to protect our neck meat out here, but can we do that the best?
Well, one thing is that, you know, no area of the face is in isolation. So when one area flows into the next area, if you just treat one area, it can kind of look awkward where your neck is one age and your face is another. Plus, you want to move that skin up, and so that skin has to go up onto the face. So usually the most natural and comprehensive result is to do both together.
That's a lot.
Yeah, it is. It's a big undertaking. If someone's interested in plastic surgery as an option, how do you go about finding someone that's reputable to do that?
Well, I think obviously everybody goes to Google and there's a lot of information there, but that's not where you should stop. There are review websites. You can also go on to individual websites. Clearly, it's important to look at before and afters, as well as check credentials, make sure they're credentialed for the work that you're thinking about getting done. And then there are third-party websites. One of the ones that's been around for the longest that I really like is a site called realself.com. And there you get patient experiences as well as reviews. And there's also a section where doctors answer questions that are posed to them. So you can do a lot of research on that site, and it's non-biased.
Dr. Westreich, you talk to so many patients. I mean, you are very well versed in your field, which is why we're so excited to have you here. What are some of the main things that people ask before they come in, you know, to maybe have something done? Because I know a lot of control freaks out there, and you can't be a control freak. You just have to put it all in your hands, Dr. Westreich.
Well, I think obviously for what we do, one of the things everyone wants to know is price, and there's a lot of nuances that goes into that. So most people ask about price. They also want to know how much of a particular procedure I do. So they'll ask some details, numbers. Some patients will ask about what your revision rate is in terms of how often you have to do a second procedure. And then kind of lower down on the list, people want to know about specific dates and availability. Because if you're like me, it's very hard for me to schedule something. So I need to do it in a very narrow window.
I've been trying to have the same lunch with my best friend for about 7 months now. You are absolutely right. Well, you know what? New York Magazine has rated you among the top facial plastic surgeons in New York. We understand it. Dr. Richard Westreich, thank you so much for kicking it with us for a little while.
Thanks for having me. It was great.